Health and Wellbeing Board for the year, and I imagine not the last one focused on COVID, but I might be optimistic in saying some green shoots in the agenda tonight, with the vast majority of the agenda focusing on recovery, so fingers crossed with that one. So firstly, on apologies for absence, I have one apology from Dr. Andrew Otley. Are there any other apologies? No other apologies. So just moving on to the next agenda item on declarations of pecuniary interest. Can I ask if there are anyone to speak up now? Okay, I'm moving swiftly on to the minutes of the previous meeting. Can I just confirm that those are a correct record? Lovely. So first part of the agenda will be a focus on COVID. I'll hand over to Dagmar, who will pick up on situational awareness reports and also some updates on vaccination and post-COVID syndrome. Dagmar.
Thank you very much, and good evening for all those in the room and remotely. I think we have got some slides, but the situation is still changing quite rapidly. So what I suggest is I give you a potted version of where we actually are, but the slides are a very helpful, hopefully, reference to ground us. So in terms of infection rates, they are steadily high. And unfortunately, at the moment, they have been undulating, I would describe them. And we are again at the moment on the up. So this is not completely mirroring the table that you've got, where we were on the down. So just so that you get a little bit of scale, recently we've been hovering around 200 to 250. This is now more 350 per 100,000 in a week. These are lots of cases. The shift is to younger people. In fact, our age group now most affected are the under 10s, and that chimes very much with most outbreaks in primary schools. So a big thank you here to my colleagues and very much to the school teams, including the teachers. They have been pretty brilliant coping with it. The good news are that hospitalizations are stable and the rates in the over 60s are stable, but we've got our NHS colleagues here and they will confirm the NHS is very, very busy, not mainly with COVID, with other things. Winter is a period of increased ill health, and there is the backlog. So it is quite precarious if we think COVID could go up again. We obviously also know all over the news that what's happened around us in Europe, we're not yet sure what will come to our shores. There are various projections and models. We obviously in the UK have been very high for quite a long time over the summer, when in Europe the rates were much lower. So that might, together with the vaccination program, the rollout of the booster, give us some protection. But nobody has the crystal ball. When infection rates are high, obviously there is always our eagle eyes also on the variants. At the moment, it is just the Delta variant. And at the moment, we've got a mutant of the Delta variant that you will have heard about, AJ12, which has been declared as a variant under investigation. So we haven't got a variant of concern at the moment. In terms of our biggest and most important tool of vaccinations, so in the slides again, I have given you data around vaccination uptake. What is very important, if Clarissa moves us on to the slide, that explains a little bit that the vaccination program now is very, very much more complex than we started out. because we have got obviously the booster initially for the over 50s now being rolled out for younger age groups at the moment, 40 to 49 as well. You will have heard in the news plans, not yet confirmed, that the booster is likely for all adults. We've got our probably biggest challenge at the moment are the 12 to 15-year-olds, where vaccination rates across the country in London and indeed in Merton are disappointingly low, and we're working very closely with the schools as well as with young people and their families to get to the bottom and see what we can learn and improve. Then there's obviously the challenge for the future. You might have heard that Amanda Pritchard has been talking about an annual booster, so our vaccination teams now need to think how vaccination can be put on a sustainable footing for a much longer time. And then there is the ongoing question, and we are expecting more information in January around the potential vaccination offer for the children, for the over fives. So plenty happening in the vaccination area. Big thanks to our teams relentlessly working on the ground, and big thanks to a number of you who have, in one role or another, have been really helping to promote the vaccination uptake. I can see we are all still keeping apart. We're wearing masks in communal areas. We're washing our hands, so we mustn't forget that with infection rates of the magnitude I've described, the virus is very much alive and well, and we also have to stick to sensible precautions as we go about our normal life. I think I'll leave it at that and invite any questions around the sort of epidemiology and current situation before I go into the next topics. Is that all right, Chair?
Thank you very much, Dagmar, for that update. Can I ask if there are any questions to Dagmar? Una?
Thank you, Dagmar. Given the rates of really increasing in primary school children, is there any update there on potential vaccination program there? Do you know? Thank you.
Yeah, so Una, good point. That's what I tried to explain, that in the US, the vaccine has been licensed, so they are already vaccinating the over fives, and it is very much under consideration in this country. And we're expecting to hear more details in January.
Are there any questions online at all? I can't see any questions. Any more in the room? No. Thank you, Dagmar. I'll just leave you to update on health on the high street.
Yeah, so here we have a few slides, and just in terms of bridging a little bit, because the two topics tonight, we can't not mention COVID, but we also really want to talk about recovery, and particularly thinking, you know, what did we learn through COVID, what we now want to take into the recovery agenda. And health on the high street is one such opportunity. So if you move us on, Clarissa. So the idea is to provide truly integrated services, particularly preventative services. And again, we're starting with vaccination because they will be with us, but to deliver them where people live their lives, and deliver in a way bundles of services that go easily together, and that clients, residents want to be delivered together. And at the same time, to revive our high streets. And this all chimes because when you go up and down the high streets, they have taken a big hit. You will see lots of premises that are still boarded up. So people have told us they want the high street reimagined and revived. And also they are tired for having bits of services delivered in different places, making it very difficult to access. So the idea is that we pilot bringing services together in locations where people are on the high street. That's what's behind the name. There are two pilots, one is in Kingston and one is in Merton. And we really want to learn from our learning from the vaccination and start with pop-ups so that we don't, so that we actually can learn, because the pop-ups give us the flexibility. And that was so brilliant with the vaccination pop-ups, because we could listen and try out and learn. So that's the idea. And as the Health and Wellbeing Board is obviously a guardian and real supporter of equity in the provision of services, that is one of the main drivers of health in the high streets, to bring particular preventative services where people are, and make them accessible to those who could benefit but normally don't access particularly preventative services. So that's the gist. Watch that space. And what I would like to invite the board is to help us further develop the ideas. If you give us the next slide. So in terms of next steps, I wanted to hear a little bit about what's your sort of first sense, and if you can have any suggestions for us taking this forward in Merton.
Thank you, Dagmar. Just before I do open up to questions and the points that you raised on the slide, has a location been determined for the pop-up?
No. So the idea is, we first of all actually thought about locations, and we were very clear the location needed to be in the east of the borough, because notoriously underserved with more difficult access. And then we felt we got quite, in a way, hamstrung, because finding the perfect location is quite an elusive undertaking, and you can spend a lot of time and not move on. So where we got quite excited, and it came actually from our primary care colleagues, who said, let's shed all that and let's do pop-up first, because pop-up allows us to try out locations. And so we were quite keen to take that on, but you're right to push us now to in a way help us to think through which one would be good pop-up locations.
Thank you, Dagmar. And I suppose just opening up to questions first, I think it would be helpful to understand what the board's view is on what we would want to see contained within the pop-up. I think over the last 18 months, we've learned a lot. We've obviously had a number of papers that have come to the board with really key learning. So if I just open up first, maybe for thoughts on what should be contained in there as a priority, perhaps. Come to Vasa first.
Project, and we are totally behind this, and I'm really happy that there's competition among PCNs. I hear every PCN wants a pop-up in its own high street, and I'm really pleased to hear that, and I hope we can have an inclusive approach where we do cater to the disadvantaged population of East Merton, but also cater to the others, because everybody has got health needs. Some have greater health needs. That doesn't mean others have no health needs. And I'm really happy that we have a broad church approach to this problem. Secondly, pop-ups are brilliant, but the community needs some permanency. It's a bit like your local pub. I shouldn't be saying it in front of you, Dagmar, but it's a bit like the local pub or your local school. You have your loyalties to your local park. And I think we need to build a culture of loyalty to our local high street health and social well-being presence. And I can tell you now, there are clinical leads queuing up to ask you to allow them to put a stall to talk about the health agenda. But this should never forget, this is a citizens agenda and a public health agenda. But we in health obviously always have our prejudice and our agendas. And we are queuing up to borrow space from you to talk about how do you detect kidney disease early? How do you prevent the progression of kidney disease early? We don't want people, especially disadvantaged people who currently outnumber more than the actual proportion in society in the dialysis ward or in the stroke ward or whatever you take it, the disadvantage are greater represented in the wrong place in the ward. I want to see them in the staff campaign, but not in the patient camp. And you're going to help us deal with that. And so we are behind you, and we really want this to start as soon as you can. What goes in, Dagmar, my opinion here is nothing is prohibited. Whatever is legal is permitted. We really need to have a very open-minded approach to this, because this is a citizen's asset. And citizens should be deciding what they want to see there. And we in health, you in public health, and the borough should be trying putting in what they want us to do. So if someone wants to talk about drug rehab, alcohol detox, domestic violence, child abuse, youth suicide, organ donation, whatever the topic is, these are all very important topics, Dagmar. I know you agree with me on this, but we need to be able to create the space there where we can talk about teenage suicide, we can talk about organ donation, difficult topics in some communities, but we can't dodge these topics anymore. And health is really behind this, and we must make this work.
Thank you, Vasa. I've got a couple of hands online. So if I go to Mohan first and then to Ellie.
Thanks, Chair. Yes, as with Vasa, I completely support this sort of process. And I have a couple of thoughts. Certainly, when Health on the High Street would suggest that you're looking to support individuals who might not necessarily access primary care. And so you need to have a magnet. What will draw people in? I think if you just shifted another hub there, it may not draw in the people we really want to target. And so a couple of thoughts spring to mind, certainly looking at our community assets, and certainly libraries spring to mind, and even the Wilsons, also Easter Borough, and whether that could be potential venues. In terms of what we put in there, I think that would depend on what our local need is. I think diabetes, obesity tend to be big issues, certainly in the Easter Borough, which could also be used across the whole of Merton. And whether we had some health checks, whether we've got one in Merton, I don't know, but I think there's a big opportunity here. And I think, as Vas said, a few of the networks are quite keen on getting involved with this. So yes, the only other thing I would suggest is digital as well, and whether there's going to be an opportunity to support digital uptake of health and actually self-supported management as well. So can patients help themselves or community help themselves, not just with health, but also social needs as well. Thank you.
Thank you, Mohan. Ellie, and then John. Thank you, and also very supportive of the idea. I'm going to focus on children and young people. I was glad to see that one of the bullets that you had there is a particular idea around kind of supporting children and young people's emotional mental health, and that's a massive priority for the sector. So I'm really glad to see that's in there. I suppose my flag is that needs to be carefully thought through about what it is, so manage expectations. So are you talking about counselling for people who really need it, or is it more kind of early stage emotional health stuff, in which case, how do you make that attractive to young people if the other stuff going on there is diabetes? I think we just need to think a little bit carefully about what it is that we're trying to do, and try not to, if we try and make it to all things to all men, will we end up actually missing out on something? Thank you, Ellie. John?
I was just going to re-emphasize that health in the high street is not a replacement for traditional GP services. They will still be there, that will still remain. And it's to echo the points that other people have said. This is a pilot, and we need to learn what works best for the population. We need to work with the population, We need to work with the different partners to find out what is best. My view, as Vas has said, we shouldn't discount anything. We shouldn't discount anything at all that could be done in health in the high street. I would support, of course, using our libraries. We've got 7 libraries in Maritime. If Anthony was here, never more than a mile away from a library. They are the hubs of the community. But for me, it's also looking at all the different places. Those high traffic areas that people go, whether that's football stadiums, whether that's supermarkets, whether that's churches, mosques, gurdwaras, wherever it is. To me, we should be open to exploring any option. But it is a pilot, and I think we'll learn as we go along. That was all I had.
Thank you, John. Mark and then Chris.
Just going back to what should be in there, myself and Dagmar were at a previous meeting where the PCNs have kind of presented their demographics. And I think it's really important because every ward is different and it has a different demographic and therefore a different need. So I think where you locate it may also inform where you're, what services you might have in there. I mean, I think the obvious ones, I think Mohan mentioned, like obesity, diabetes, mental health, and certainly for children and young people's mental health as well. But I do think we have to ask our communities what's going to work, what's going to bring them in, because, you know, we can we can set these things up and actually, you know, the success of some of our pop-ups when we go into the communities, but the communities tell us how to do it, that's going to be really key, I think.
Thank you, Mark. Chris?
Yeah, thanks. I just wanted to come back on the location point. I won't talk about the content. I'll leave that to the health experts, but you'll come to the later slides this evening about the feedback around your Merton. And there's a very big message there from the public about reclaiming and recovering the high streets. They're under huge pressure because of the change in the way that we shop, the internet, but also planning legislation. So I hear about in the meeting the desire for us to think about locations for health, possibly in libraries. Some of those aren't on the high street, possibly in religious faith buildings. Some of those aren't on the high street either. I'd really encourage us to think about how we can get this as close as possible to the high street, because that's the message we're getting from the public. There's a high street task force underway at the moment, looking about how we can recover the high street. The public want to have more community use back in the high street. And I think the more we can put health into the high street rather than places near the high street, I think that would be a huge benefit.
Thank you, Chris. Were there any other points to raise on those, or Dagmar, did you want to come back?
So maybe briefly, so thanks very much. Also, a number of you had already put in, and then every time we rethink it, it is very helpful. So in terms of a summary at the moment, we've heard, Chris and I'm with you, and we discuss more. As it says in the name, it is health on the high street. We are aware of that. The pop-up allows us to learn, and the pop-up allows us to really hand over to our citizens and community. And we have to allow that to happen and learn with them. I think that is the exciting new bit. And so we absolutely will try it out on the high street. So Chris, at least that we have the evidence. I wanted to quickly respond to Ellie as well, because we've thought quite a lot about young people, older people, different cohorts. Again, we need to have an open mind and an open book, because we've also got quite a lot of feedback around intergenerational opportunities. Again, the way we design this and learn is by trying out. Thank you.
Thank you, Dagmar. And also just to bring in Una.
Just very briefly, I was just thinking, whilst you were talking about the high street and also the need for pop-ups and being on, and getting out to the different communities, there are quite a lot of empty shops on the high street. So that would spring to my mind for, as perhaps some quite ideal venues, albeit I do also hear the different communities with, say, whether it's church or mosques and so on, and also like the idea of the football stadium, because certainly in my ward in Wimbledon Park, with our football stadium, AFC, the Cherry Red Stadium, it's been really well used, as you know, for the vaccination program. So I'm sure they would be open to further community support. They've been very supportive of the community. So yeah, but yeah, it's exciting. Thank you.
Thank you, Una. And hopefully the pilot would provide sort of learnings to allow us to scale up, but also use some of our other community assets. Just one last question on this before we move on to the next agenda item. It's just about timings. Do you, Dagmar, have any sense of immediate next steps with this?
Yeah, so obviously we wish it could be yesterday. The reality is that it's very busy out there at the moment. So we have to be a bit pragmatic, but we are really hoping to get going in the new year.
Great, thank you. And I think, Dagmar, you're also going to feed back on post-COVID syndrome, just moving sort of segue from the pop-up into that.
Yeah, sorry, one more and then you hear somebody else. So very briefly around post-COVID, purpose to share with you as well is that the Health and Wellbeing Board subgroup is particularly working on post-COVID with a particular, with a particular focus on ensuring that the services for post-COVID syndrome are accessible for those who have suffered most. So if you give me the next slide. So this is just an overview. There's quite a lot of learning still happening around post-COVID. It is basically the term, some people will know the term long COVID, what happens after you had an infection and it's not going away. You are not back to normal. And there's a myriad of different symptoms. And I thought this slide is actually quite a neat summary of what we understand now, but it is a research area in a lot of flux. If you move us on. Equally, we're trying all sorts of methodologies to get a grip on numbers. As you can imagine, there are different ways of counting. At the moment, what we've used is a formula from the Office of National Statistics, and we've applied that formula to Merton, assuming that Merton isn't categorically different to the rest of the country. And the way it works, it's quite hard to get your head around, but this is a idea of what we call a spot prevalence. So at any one time, how many people do we think suffer from post-COVID syndrome? And as you can imagine, as we've got ongoing infections, we in a way feed that pool of people with post-COVID syndrome, but some people obviously also recover. So it's quite a dynamic picture. So the data here is from August, but our infection rates since August have been sort of hovering around the same amount. So as it is a dynamic estimate, we think it is probably roughly right. Now, with the change in age groups, it might change. You might be aware that generally the assumption is that post-COVID is less frequent in children. And as we're currently seeing a lot of infections now in our little ones, it might mean that our pool is slightly depleting. But on the other hand, we have never had high rates in little ones. We could also be in for a unhappy surprise that more post-COVID in children comes to light. So we're in a situation where we have to be totally open-minded. If you move us on. And this is it gives you a rough overview of the service offer at the moment. So it's a staged approach depending on the severity of symptoms. A lot is happening in with self-care and in primary care. And then it's in a way a hierarchical approach with very specialist input for very severe symptoms that haven't responded. Now, as we don't really understand exactly what's happening, a lot of the services are support and it's exclusion of other pathology. What I wanted to draw your attention on is who's actually at the moment accessing services. And where we put the footnote on is where the health and wellbeing subgroup is particularly wanting to come in. So clients or residents from most deprived communities have not really accessed this service. And as we know, and from previous discussions, that the burden of COVID disease, particularly wave 1 and 2, has very much fallen on the more deprived. There's a clear mismatch between what we expect, where the burden of disease lies, and who is accessing services. Now, it's very early days. You can see the numbers are small. We assume we have got over 2,000 and there are only 140. But there are some signals that are quite important. So a lot of work is happening. What we call case finding, working with our community champions, working with the voluntary sector to promote and raise awareness about the existence of this service. So a number of you have been really helpful. And then ongoingly, to really, again, in the same spirit as we've discussed before, work with those people who suffer with post-COVID to say what matters most to them in terms of support. Because, you know, it interferes with work and interferes with caring roles. There are all sorts of consequences for people being stuck in post-COVID that we would like to tap into much wider support services to help them. So that's hopefully a brief overview with the next steps here, and for the board to be aware what the subgroup is up to, and any ideas and input suggestions from you, welcome.
Thank you, Dagmar. And it's probably quite nice that we've had this follow on from the Health on the High Street pop-up in terms of how we best reach our communities, particularly our deprived communities, from this perspective. But I will open it up to questions, any sort of broad questions on the report to Dagmar, or any suggestions on how we do better reach our sort of deprived community in terms of the uptake of the service. Mohan?
Thank you, Rebecca. Thank you, Dagmar. I again absolutely agree with the need for post-COVID support. And certainly I've got a couple of thoughts around this. So we've got the most severe patients who suffer from post-COVID syndrome, who are being seen in the trusts, are seen by CLCH, our community providers. And we've had a lot of discussions with them around some of the cases they're seeing, and a lot of it is becoming social now. So they're seeing them on regular reviews, and they're looking at their physical symptoms and getting it to as good a place as they can get to. But now they're identifying that they're having a lot of social needs as a result of post-COVID, implications on their employment, relationships, job, and lots of other things. So actually we've opened up a dotted line for this post-COVID clinic to refer into the social prescribing service across Merton. So as we know, social prescribing is now in each practice across Merton, and so they're able to refer in directly. And we know that's not going to flood the service, but this is for Merton and Wandsworth. and we guesstimate that there's about 30 referrals which can be sent back to primary care. So I think that's a really good, nice integrated way of supporting patients who are severely affected by this. I think those who are not severely affected, who haven't needed hospital admission, there's also a link for the link workers to also support them, and they've been trained up in terms of what to look out for and what support might be available for them. And certainly if there are some physical symptoms, they will need to sort of contact their clinical supervisor. I do also want to make you aware of a wonderful project we did a couple of weeks ago was on group consultations, and that was on post-COVID as well. So we got a group of patients, we had 15 of them, and we talked to them all about group consultations, and they actually were great therapy for each other. And actually listening to each other's stories, that actually this is a new uncharted territory we're entering, and actually there isn't no solution for this. And so listening to how they manage themselves, and you talk about it, self-supported management is really, really key. So I think if we can maybe promote those sort of things, the self-supported management, and actually look, we're in this together, and actually these are what you can do if you haven't got physical symptoms, and how we can help you socially. So there's some of my thoughts, but I agree completely. It's something which we'll probably see more of in the new year. Thanks.
Thank you, Mohan. Some really great insights there, and just sort of handing over to Karen.
Hello, thank you. Yes, I'd just like to echo what Mohan has just said. Question for Dagmar: are we capturing in the data people that are going in directly to secondary care, to the specialties? I just wonder who aren't coming through the GP referral route because they've got symptoms that are specific to a particular symptom like cardiology or respiratory. So I just wondered if that may be partly accounting for why some of the numbers look lower. And then the second point was, as the main link into the services through primary care, I'm wondering whether language barriers may be playing a part, particularly as some of the symptoms of post-COVID syndrome can be quite vague and difficult to articulate. So I wondered if any thought had been given to promotion of the service in a variety of languages, and perhaps some education for GPs as well.
Yeah, I think spot on points, Karen. With regards to the numbers, you're absolutely right. So we're only counting the ones, or the snapshot you've seen is from patients from the CLCH service. So it is not the totality. That at the moment is the first snapshot. I was very keen to get the distribution. Now it is only a part of the service, that's fair enough, but I felt in terms of a hypothesis that we might have some equity issues, seems to be at least hinting that for the CLCH component, we have to work right from the beginning a bit harder on that. But we are trying, and we're working with colleagues across Southwest London to compare as well data and see what's happening at hospital level. So really well made point. And the other one around language, I would go further. It's around cultural understanding and cultural acceptance of what post-COVID possibly means. So we have had a discussion with our community champions, who obviously have more outreach, and so acceptance in some communities. There has been quite a bit of mixed messages around people putting it on, people taking advantage. So there is layers and layers to work through, and hence the plea as well that that service model is an evolving service model, and we continuously check and listen what type of support and approach will work with different communities, and language obviously is one really important part.
Thank you, Dagmar. I can't see any final hands, but in terms of next steps, I imagine that this will continue to come to the subgroup, and that we'll get an update to the board as well. So just moving on to our next agenda item, which moves us, although COVID isn't behind us, moves us into recovery. And I'll hand over to Chris, who has already mentioned some of the findings from the Your Merton consultation, but some really exciting findings that will help us shape some of the work that we're doing and also provide an update on our work in climate change. So I'll hand over to Chris.
Thanks, Rebecca. I've got a few slides. I'm hoping that somebody will be able to put those up and just take us through them. What I'm essentially going to do is talk through what the findings are from the Your Merton consultation exercise, what the emerging response is, and what the opportunities might be for the board, and then say a little about climate change. I know this was listed as equity and sustainability, and that's probably absolutely right. It's certainly at the heart of the response that we'll need to provide to Your Merton. If we go on to the next slide, please. Your Merton, just to remind colleagues, is just one of the recovery and modernisation projects that the council's undertaking. There are some others there. Some of them are very internal about the way the council works. Smart working, for example, is the way that we are adopting some of the benefits that emerged out of lockdown. But you can see some others there which are more externally focused around passenger transport and procurement, for example. But Your Merton, I'm just going to talk about now. And if we turn to the next slide, what I'm not going to do is remind you about the purpose and the way in which the engagement was undertaken. I think we've spoken about that before, and I suspect many of you have contributed to the engagement exercise. What I'm going to do instead is just talk a little about the themes that have emerged, particularly those which are relevant to this board. This slide just sets out the common themes that came up. Throughout the engagement, residents were most positive and proud about green spaces. That came out loud and clear, and we'll see that later on in this presentation. And about the vibrant community that they believed they were part of. They were continually frustrated by traffic and litter, and that came out loud and clear. COVID brought challenges of isolation, but also a real appreciation of community spirit, and that's one of the things that we want to build on, and you'll see that later. And it led to a set of shared ambitions that have emerged, and echoing some of the points we heard earlier, around the high street, that came out very clearly, and an ambition to make the most of our green spaces and opportunities in there for health and well-being. So unfortunately this slide builds, I think, the way it's been put together. So if you don't mind just clicking right through until that's it, that's the whole lot. What emerged, as I've said, is that picture about high streets, about strengthening communities and utilising the assets around our green spaces. A separate set of messages around a real belief in the local identity of neighbourhoods, and particularly the importance of the high street near that neighbourhood. A real emphasis around connectedness, and that means both transport but also connectedness to communities and people that emerged very strongly through lockdown. And the point around ownership is a couple of points in there. One, a real message around ownership of housing and people feeling they didn't have a stake in the community, whilst they were a private tenant in some instances, but also a sense of the need for us to, or for residents to reclaim ownership of community assets and for there to be more of those community assets locally. So if we turn to the next slide, please. And it was a real focus. What's emerging is a very much a place-based recovery. And these four headings and climate change, which I'll talk about later, are the four real areas of opportunity for the Health and Wellbeing Board. And the first of those is green spaces. What emerged, if we just click on a couple of slides, please, and I'll just show an extract from the Traverse slides. What came across loud and clear is that green spaces are by far and away the most valued asset, or the most important aspect of life in Merton. You can see there it came at 67% of those who engaged with the exercise put it down as their top aspect, their number one aspect of the borough, well ahead of public transport. And they noted very clearly that this is distinct from other boroughs, that Merton is pretty much unique in terms of the proximity of good quality open space nearby. And COVID particularly emphasised that with people working from home and with less opportunity to get out of the borough to other parts of London and beyond. It was a real asset for both physical and mental well-being. And that came across loud and clear. It allowed people to get out and connect with friends and to engage with nature, get some exercise, to relax, but also places for biodiversity and a contribution to climate change, which came across loud and clear in the engagement exercise. Getting the balance right in terms of the way that we use those green spaces, those assets, is quite a challenge, because for some it's about sport and exercise, for some it's just about relaxation and quiet, for some it's about more biodiversity, and for some it's about events. And actually that came across from many people, that they want to see us utilising those assets for more events. How we strike that balance will be quite a challenge. But what's clear is that the public want us to make more of our green spaces, and there are fantastic opportunities for health benefits in our parks and green spaces. The opportunities for volunteering as well as just using the space is significant. What came across in here, as with many other aspects of the issues I'm touching upon, is a difference between perceptions in the East and the West, and the quality of some of the spaces differ from across different parts of the borough. If we go on to the next slide, please. And I'm just going to talk a little about community and that community spirit, and the need for us to think about how we can strengthen that sense of community spirit and social capital. Because what we're hearing through the engagement exercise is that COVID generated a new type of community spirit. Residents got to know their neighbours more. Home working meant that they were around more, and those connections were more likely with people locally. And there's a real ambition for a more inclusive community and opportunities to engage with each other. And that has a place dimension as well as a people dimension, because what the public are saying is that the good public realm is absolutely key to that, to be able to provide the space for people to meet and socialise, either in the open or in community spaces, community centres and other buildings. And this bled into the point later around the high street, and for the need for the council to promote a better high street, which I'll come on to in a moment. A clear message here around public spaces being safe, free of antisocial behaviour, clean and attractive places people could be proud of. And litter and cleanliness, as I said earlier, was a key concern. So those day-to-day maintenance hygiene issues need to be resolved to give people the confidence about those spaces that can add to people's quality of life and respond to the findings. The next point, if we could move on, please, was around transport. And this is an area where we've talked previously at the Health and Wellbeing Board about the opportunities. And the experience of the pandemic showed what can really happen when you have less car-based transport. So if we move on to the next slide, please. More than 25% of all those who responded referred to traffic situation in the borough. Some of it was a little bit schizophrenic. More people wanted places to park, as opposed to some of the respondents saying, actually, there's far too much traffic in the borough. We need to move back to active transport and public transport. And the issues ranged from road maintenance issues to air pollution to traffic issues, parking controls. But what many people said was that for that short period during COVID, when lockdown was in place, the impact of less traffic could be felt. It was very tangible, and the improvements were there, and it allowed people to connect more locally in safe spaces. People could feel the air quality improvements. Active travel was easier. People felt safer to be able to get on a bike and get out, and people reclaimed the roads and the streets, and we'll see some images in a moment. It was safer, and there's a real ambition for us to rethink transport in the borough and how we can promote active and sustainable transport even more than we are now. Now that will be a challenge because colleagues will have read more recently the challenge that Transport for London has in particular, and the funding that flows from them to the boroughs is already being signalled as being less than we might, well, certainly less than we've had in the past and less than we might expect in the future. But there's a real appetite for us to do more around this, particularly around the active transport, which has got huge health benefits. We move on to the next slide, please. And the last of the 4 points I wanted to raise was one that's been picked up earlier, really, which is around the high street. And that shared desire for a revitalised high street, for us to rethink the nature of it. We move on to the next slide, please, because as I said earlier, the high streets are changing, whether we like it or not. Online shopping, the planning legislation, some of the big shopping locations, the pension fund investors are rethinking what they want to see there. And that's happening whether we like it or not. What we're hearing from the public is that they want us to cherish the high streets, and that doesn't just mean the Broadway in Wimbledon. That means, you know, the local high street. It means the places where people go, where they meet their neighbours, where they meet others. They go to shop, but that's not always the case. They want us to think about how we can make those better places, better quality public realm, but also better things to do there, whether it's services or shopping or community facilities, and health on the high street is one that we've heard about this evening. So there's a real ambition there, and we know that we've got some negative influences on the high street, some negative influences that we find it very difficult to deal with, whether they're betting shops or some of the pubs that cause some antisocial behaviour. But a shared ambition here for us to do more in terms of the high street. So I think there's just before I move on to climate change, just a few images to break it up, just to I think this is Singlegate, where we've now got a school street. The next image, I think, is one around one of the parklets we've got up near Wimbledon, where we've invested in rethinking the way that we use public space, particularly during lockdown. But that's been so successful that we're putting more parklets in for different uses. And I think the last one is an image of the market, and we've invested more in markets. This is in the west of the borough, and we've Mitcham Town Centre's had a smaller scale market, but a real appetite for us to think more about pop-ups and permanent markets across the borough. So as a consequence of all of that feedback, these are at the moment the draft priorities, the 5 draft priorities that the members have developed alongside officers in order to respond to the findings. These will be shared subsequent to this meeting, so I won't go through them in any great detail, but just to talk a little on the next slide about the timetable, because at the moment we've published the engagement findings. They've been through a scrutiny process, and we're starting to plan to respond to those findings with some action plans for the short, medium and long term. And in the early new year, we'll be taking those through Cabinet and on to full council. So there's still an opportunity to shape those priorities and the action plans that follow. And hopefully with the Health and Wellbeing Board and the work that we're doing with public health in particular, we'll be able to ensure that that response is as robust as possible. Conscious of the time, and I'm just going to talk a little bit now. I think I'm going to move on to the climate change, unless, Chair, you want me to pause there and we just take questions on your Merton, or I move on to the climate change slides straight.
Oh, sorry. Thank you, Chris. I wonder whether we cover climate change as well and then come back for questions, if that's okay.
That'd be great. So just a few slides on climate change. It really is just an update and I suppose a plea for some joint work with colleagues. The first slide's quite a busy slide, but what this sets out, I think, very clearly on the left side are the health and well-being strategy priorities, and then very clearly the way that the action plan on climate change sits very closely and aligns to that. We know there are a huge number of health co-benefits from actions to reduce climate change. The 4 key areas of actions in the climate strategy and action plan, you can see there: buildings and energy, transport, the green economy, and greening Merton, and a large number of actions down the right-hand side that we're already rolling out in order to respond to those, many with health co-benefits, whether it's around anti-idling campaign and improving air quality, our work around flood risk management, work in low traffic neighbourhoods and school streets, improving the quality of the environment there. If we move on to the next slide, please. And this just sets out some of the actions that are being undertaken by the Climate Action Group and developed by them. The Buildings and Energy subgroup, for example, working around pilots in Merton to empower younger generation with knowledge to drive behaviour change. Transport work stream working around some Sustrans projects on Big Pedal, World Car Free Day, and some of the work that we've been doing around low traffic neighbourhoods. You can see there green economy. And where you see a pound sign, that means that those schemes have attracted funding from Merton Neighbourhood SIL. So we're being able to put some significant cash into those in order to support those projects. And just moving on to the next slide and moving towards a close, what we're pleased to say is that the council has allocated an additional £2 million for climate action, because one of the main obstacles has been the limited capacity to drive this agenda. And a huge agenda it is, really, particularly around energy and around transport and around behaviour change. 98% of the carbon is outside of the council's direct control in Merton. And so over the next 3 years, that 2 million will allow us to put in place projects to draw down whatever external funding we can access through government and other sources in order to drive the programme around particularly energy, transport and buildings retrofit, housing right across the borough. So that's underway at the moment. And I suppose the next slide just gives me some cause for optimism. This is the council's CO2 emissions, with the last of the bars there being 2021. And you can see there that it's been a steady decrease ahead of target, thankfully, and one which is aiming to get us to our 2030 target quite successfully with the trajectory that we've got underway. The last slide is really just a call to arms for the Health and Wellbeing Board in terms of how you can help, whether it's through support to the climate strategy for the council's climate strategy and action plan, or via the Climate Action Group in your own health activity around NHS net zero targets and the NHS Green Plan, or looking at how we can have shared communications activity and behaviour change projects, some of which we've been doing with public health colleagues. And linking back to the point earlier around green spaces, how could we make those more part of our contribution to climate change, biodiversity, and contribute to a healthier borough. I think that's the last slide. Thank you. Happy to take any questions, Rebecca.
Thank you, Chris. And I know that the NHS Green Plan is later on the agenda, so it would be good to see how there might be some overlap with some of the work that the council is doing as well. I think also reflecting on your Merton at the start of this meeting, when we were talking about health on the high street, we talked about how we want to hear from our residents to help shape what that looks like. And I think we have a great opportunity with the findings from your Merton in terms of shaping what we do together, particularly as we speak later about the integrated care system and how we're working closer at place. But maybe if I can open out to the board, see if there are any questions or comments for Chris. Dagmar.
Yeah, hi, many thanks, Chris. And I think we are a really lucky Health and Wellbeing Board that we have Chris on the board. It is the conditions for people to thrive that are so tricky, but so important. Not every Health and Wellbeing Board has it. So big thanks there. And also for Chris to really draw our nose into it. Climate change is so interlinked with health that, again, as a Health and Wellbeing Board, we would really be failing if we're not facing up to climate change. But where I wanted to particularly push us a bit is on the core benefit agenda, because it's not too long ago that this board really put a lot of effort in tackling diabetes as a whole system. And remember what drives diabetes? Physical activity and the food environment. And if you think about mitigation actions for climate, there you have your sedentary behavior versus active travel. And we haven't mentioned under climate change, because I know there is controversy, but the food environment is also a really important part. And so as a public sector, we can't do everything, but we can look at what we can do. So drawing the link between what can we do for diabetes and saying, actually, the same things, the same behavior changes that are good for climate change are also good for our health. I think there is big potential to spread that more, to get our young people involved, our schools involved. So it's great, Chris, that you open our eyes in a way to that possibility.
Thank you, Dagmar. And I think an exciting opportunity to potentially look closer at this as a Health and Wellbeing Board, particularly as we're moving away from focusing as much on COVID and more around recovery. Are there any final, Rob?
Yeah, thanks, Chair, and thanks, Chris, as well. I was really interested in some of the it's hard to disagree with some of those observations. What's available in terms of food? I think I might be skipping a bit, am I? Yeah, sorry. Can I put my question in the chat then, if that's going to be problematic, because I don't want to disrupt the recording.
Rob, you're back now, so
oh, okay.
Could try.
So I'll try again. So I was just interested in some of the residents' observations about Mitcham and Morden Town Centre, and it's very difficult to disagree with some of their observations about what's available to eat. And coming back to Dagmar's point about the issues around obesity and diabetes, I'm just wondering, because they're not new issues that I don't think Mitcham and Morden in particular have changed much in recent times. I'm just wondering what new powers there might be, or new ways of working together as a system to try and influence some of that change and change the way in which those particular town centres look to offer more healthy options, I suppose, more than anything else.
It's a very good question, and one that we've really struggled with, probably more so in Mitcham, in terms of trying to get a vibrant market operating there, one which sells, a variety of low-cost vegetables and fruit, and it probably needs us to rethink how we can get the right market rates in order to attract the right stall holders and get the right footfall. We've worked hard to get the transport system operating better there, so that the buses actually go through the town square and people can get on and off, and that has added to the footfall in Mitcham Fair Green, but it hasn't done it such that it supports the sort of market with the sort of traders and the sort of produce that you would necessarily want to see. And regeneration in Mitcham Town Centre is quite hard because of the fragmented ownership. Now, we do know that the owners of the Morrison store are now talking about the potential for development there. So that might offer the opportunity for some regeneration, and allow us to change the mix and change the content of what we have operating in the market. Morden is more possible because of the extent of the plans that we've got for regeneration in the town centre. And the 2,000 extra homes, which will provide the footfall and the purchasing power for the sorts of buying opportunities that you would want to see in a modern town centre. So Morden, I think, has got, in the near future, and certainly over the next 10 years, more opportunity for us to be able to regenerate and deliver the sort of place that people would be proud and want to live in, and offer the sort of range of produce, hopefully at the right price, that people would wish to have, and it will be on their doorstep without the need to travel far, and so on. Mitcham is more of a challenge, and I think we need to put our, we can't shy away from that. We will really need to think about how can we ensure that Mitcham is a healthy place to be able to go and shop and buy the sort of food you will need to cook in order to respond to the climate change that we face.
Thank you, Chris. Dave.
Hi there, can you hear me? Because I've got my headphones on, I'm not sure if the mic's working.
Yes, we can hear you.
Oh, that's good. No, it's just to refer back that there's also intelligence gathered in 2015 when it was under the heading of Healthy High Streets. We did Healthwatch did a piece of work with public health actually on Mitcham itself, just Mitcham, which had about just under 200 residents involved. And that kind of gears along with everything that Chris was saying. In particular, things around fast food betting shops, etc. And I know back then they were looking at things around licensing and making it harder to have certain establishments obviously have a take up in the high street. But I think that comes with its own difficulties as well. But there's intelligence there that could also be used that I'm willing to reshare again if that's of use.
Thank you, Dave. And I think at an upcoming meeting, we will be also revisiting healthy weight and strategy behind that. So that would be a helpful sort of foundational step for us as well. Great. So thank you, Chris, for presenting an update and feedback on the Your Merton consultation, but also an update on climate change. And hopefully we'll be able to bring this back to this board to look at what we can do together in more detail. I'll just hand over to Mark and to Vasa now on health and social care recovery priorities. I think the first thing for us to focus on was the local health and care plan refresh, which is for us to discuss and to agree.
So if I lead, and Vasa will jump in when he wants to, just to say that the previous health and care plan was from 2019 to 2021, but obviously we've had the pandemic right in the middle of that. So actually some of what we're doing is picking up from where we were before, but also seeing it through a lens of what we've learned through COVID, and also particularly in terms of health inequalities. So I won't take you through it word by word, but just to say that this refresh covers 2022 to 2024. It should relate to the JSNA and absolutely those the needs that we have identified in the different populations that live and reside in Merton, and also that we wanted to highlight some of the projects as we go through this. This isn't the totality of the work that goes on in Merton. There's a lot that goes on that won't be in this plan, but it's a reflection of where we can really make an impact together. It will report into the Merton Health and Care Together board. And so that will be the monitoring mechanism as well. And then we will feed that back into the Health and Wellbeing board. And it should sit alongside the Health and Wellbeing strategy. So next slide, please, Chris. Just to say, next slide after that one as well, please. And the next one. So we wanted to really make sure that we had listened, and there was an engagement across the summer where we listened to voluntary sector organisations, patient groups, sector colleagues, local authority colleagues, etc. And some of what they were telling us was, actually, we really need to listen. We really need to listen to what the communities are telling us. Mental health was obviously a big issue across Start Well, Live Well and Age Well. And the impact of COVID, we've seen that sort of being extenuated. Communicate about services, have a dialogue about services with our residents, and really tell people what is out there and how they might access it. And I think there is a golden thread in terms of health in the high street around really how people access services and where we put services. Cultural sensitivity, which many of us would say, oh, that's obvious, but actually it really is important that we reflect our services and the cultures that we're trying to serve. And then prevention and early intervention, going back to a lot of what Dagmar's already said, and really looking at Merton as a healthy place, not just a range of services. Next slide, please. So again, in our Start Well, Live Well and Age Well, that is how we've split up the activities. And just to say that I really like the focus of this, because I think it starts to talk about communities and schools. It starts to talk about how we, again, access services in a different way, and following on from the previous discussions. And also in the older people domain, it talks about the role of the voluntary sector and really building on the success of the community hubs and the community response hubs. How do we build on that as we go through the next 2 years? It reflects on the achievements, certainly looking at the community response hub, the mental health services in schools that I know the Health and Wellbeing Board have talked about before, the Merton Uplift services, which provide services for adult mental health. Mohan touched upon social prescribing. I mean, it's award-winning social prescribing services in Merton, so we should be very proud of that. And also the diabetes champions. And hopefully in this conversation, you're starting to hear the themes, aren't we? We're starting to hear the themes just at this meeting. So the aim of the plan, reduce inequalities, use population health management to really target services, sustainable change, so change that actually makes a long-term difference to our residents, and also have an ongoing dialogue with our partners. Move forward a couple of slides. Yes, stop. We want to change how people access services. We've talked about health and high street. We're also going to look at delivering mental health services in a hub for Black and ethnic minorities, and that's a pilot that's working elsewhere in Wandsworth, and actually we're going to lend some of that and bring it to Merton. We've talked about the community hub and the voluntary sector and extending that, and also really looking at personalised care, you know, acknowledging that everyone is individual and the factors that impact them are very individual. We want to reach into communities, develop new roles across all our domains. It's not just about primary care new roles, it's about lots of new roles across sectors, and joining up some of our services and joining up some of our teams to really develop services more effectively. In terms of the specific issues that have come up, obviously mental health, children and young people's mental health, diabetes, obesity, long COVID or post-COVID post-COVID syndrome, cancer, alcohol, and also acknowledging that a vaccination program on the back of Amanda Pritchard's comments will now be an annual thing. So vaccinations is not going anywhere soon, and we are going to have to build that into the way that we deliver services. Really importantly is how we engage on the plan. And on the delivery plans. So this is what I'm showing you today as a summary. Behind this, there is a much more detailed plan, which we are working up to take through the Merton Health and Care Together, which has the specific projects, the specific targets, and the specific metrics that we're going to measure ourselves against. We want to listen, but we also, I think, particularly in Merton, have a really strong platform of partnership. I think our component parts are all really strong, and together, if we put them together, they can be even stronger. We want to engage in new ways. So remember that we are in a digital world, but actually also we need to be aware of those that are digitally excluded from our conversation, and we need to make sure that we're doing something about that. And also going back to my comments and Dagmar's comments, we need to work with leaders in the community to actually tell us how to best serve those communities and use data, but it's not just data, it's the insight data gives us, it's the intelligence data gives us. So we brought the summary here to just ask the Health and Wellbeing Board to kind of comment, are we on the right track? To acknowledge that we will take this through the Maritime Health and Care Together board, and we will work up a much more detailed plan behind this about particular projects in the areas that I've kind of highlighted to you. But just to go back to the original theme of tonight, I think is really about changing the way that people access services. Vasa, anything you want to add?
In health can have tomes and tomes of projects and papers and plans. Unless we connect with our citizens, that 20% who eternally miss out will eternally miss out. That's a perpetual fact of life, the inverse care law, since the NHS was founded. And we got to stop saying it, that is a perpetual fact of life, that that inverse care law. And we have to reach out with your high street project, with our health champions, like we did with COVID champions. Sorry. Thanks, Mark. That's why Mark comes along to mind me. We have to reach out, and we got to stop that inverse care law, and we got to make it happen through the champions, through the citizens, through the high street health provision, so that those disadvantaged people who miss out due to barriers to access, linguistic barriers, cognitive barriers, disability-based barriers, whatever the barriers are, and we have to stop this. Otherwise, we'll carry on just saying the same story eternally. And we are committed to work with the citizens and the faith groups, the non-faith groups, whoever will have me. I'm willing to go out to talk about. There are a few medical topics my colleagues here know what my weaknesses are, but apart from that, most topics I'm willing to be myself to be present there. The topics I'm weak in, I can bring other people to talk about. Dagmar, before we leave today, I really want to talk about the uptake of COVID vaccine among pregnant women. That is a national disaster. It's a tragedy beyond belief, because the majority of people who end up in ICU, women of young age, are there not because of COVID, because they are there because of COVID and pregnancy. And it's real sad tragedy. And I think we got to work on that, if you don't mind, because we all know the cases are flattening, but they're still quite high. And the youngsters are getting it, the young mothers are also getting it. And if I can send a message out to help us to reach those pregnant people, to explain to them, it's not, I'm not making it up, Dagmar knows it's true. If you go into ICUs, if you go into the wards, pregnancy is, in the first wave, there was obesity and ethnicity and over 70. That story is an old story now. And I think we really need to talk about this young people, and through schools and wherever we can meet young people, we really have to get this across. That's a tragedy which is avoidable.
Issue, doesn't it, as well, that we were talking about earlier? Because if COVID's in the primary schools, then of course that's where the mums are, and some of them, it's like pre-pregnancy that you need to be getting them, isn't it? Pregnancy, it's almost too late. So it's like, you need to take your folic acid before you get pregnant, and you need to get vaccinated before you get pregnant, seems to me. But yeah, thank you.
Thank you, Una, and Mark and Vasa. And I think just shows that COVID is still with us. So while we are building towards recovery, COVID will continue to form part of this plan. And I think really the presentation reflects a lot of what we've discussed already this evening. So it feels like we are on a good track. And just from my perspective, I think while there is a lot of detail that sits behind this, it's really nice to have a short, snappy document versus what we are sometimes have been accustomed to, particularly I think when we are discussing with residents in particular about what our priorities are. It's really helpful for us to have something like this. But if I could ask whether everyone is in agreement really that this is going on the right track, if there's anything that's missing at all, I'll open it up.
Dave from Healthwatch Merton again. I think there's a lot of stuff in there. It's good, The one theme for me that seems to maybe necessarily not getting the focus it needs is obviously we keep talking about digital world, increase of online as an access point, and that's about improved information communication about local services, etc., across health and social care. So to me, there needs to be something around information equality, whereby we either have a group that or pull something together that can actually really focus on that and tackle the issues around people being able to get stuff in preferred format, easy read, etc. And I think, especially given the current climate and where we're at, that we've had groups that have obviously from the pandemic has shown that, for example, visually impaired people were not able to access vital health information in their preferred format, which is obviously putting their health at risk. But there's other groups across that. So as I was saying, for me, I just think that given how critical information flow is and the information sharing is, I just wonder whether or not within the actual, even within the health and care plan overview, that under improved access to information and services, etc., whether there's a part in there around information equality or something like that that makes it as a core issue to be looked at in how, because if people are going to start accessing via website and online, we want to at least get that right first. So for me, I just think there's a thread there around information equality that goes back to some of the beginning stuff that Mohan was talking about around COVID and people accessing primary care services, etc. And I just wanted to pose that as a question.
So I totally agree, Dave. So we can take that away and strengthen that part of the plan and make sure that there's a within the deeper plan, the more detailed one, that actually we flesh that out more. So yeah, no, very good point.
Thank you, Dave. Were there any other comments or questions about the plan at all? No? Are we all in agreement that we're happy for this to move forward to Maritime Health and Care Together agreement? Looks like no dissent. Great, thank you, Mark. I think the next item on the agenda is also for agreement. It's sort of a quick update on the Better Care Fund. Again, I'll pass over to Mark.
So I think we do have quite a lengthy slide deck because we don't like to disappoint. But actually, I'm not going to take you through it at length. We'll just there we go. So Better Care Fund, a national policy, and it's around the pooling of budgets, but I'd actually like to say it's around the alignment of budgets, because it's a ring-fenced local authority budget and a ring-fenced health budget. And if you go through 2 slides, next one, please. That just gives you the detail of the kind of the contributions across our different organizations. We align these budgets, and coming into the ICS conversation later, I think one of the things that we want to talk about with the Health and Wellbeing Board in the future is really how do we start to pool resources? How do we start to integrate even further? So I'll leave that kind of question hanging and we'll pick it up at the ICS. So next slide, please, Clarissa. Again, it aligns to the strategies, not only of the health and wellbeing strategy, but also carer strategies, hospital strategies. So it really should be around out of hospital and hospital services, making sure that we are investing in the right places, and that's lined up and aligned, and there's a narrative across our different organizations. Next slide, please. Next one, please. Keep going. Keep going. So it really is about us bringing together our different strands of work. It's a pooled budget via the Section 75, and it was just to assure the Health and Wellbeing Board that actually this really is about, for the council, it's about re-ablement services. For the health services, it's for things like the discharge to assess, and making sure that we're really bringing people out of hospital as possible and keeping them out of hospital for as long as possible as well. Officers in both of the organizations have put this together. They've worked at length in terms of defining the finances and the projects. And for bringing it, it needs sign off at the Health and Wellbeing Board. So we wanted to bring it here for assurance and for sign off by the Health and Wellbeing Board. So I'll probably leave it there and take any questions.
Thank you, Mark. Were there any questions on the VCF at all, or any comments, of course? I
can't see any. Is everyone happy to agree that paper? Looks like a yes. That was nice and quick. Didn't have to go through all the slides. Thank you, Mark.
Just another 7 presentations.
Looks like another 3. I think, Mark, do you want to pick up on the Ics transition, which a nice segue on?
So again, our health colleague can jump in, but what we just wanted to do here was provide you with an update, because I know that we have this integrated care system that everyone goes, what exactly is that? So actually it is the coming together of different component parts of the system to improve outcomes, tackle health inequalities and social inequalities, make sure that we're spending taxpayers' money effectively and efficiently. But also, I think really excitingly, it talks about social and economic development. So health is not just about health, it's about extending into housing. It's working with police, it's working across the board. I'm going to keep this really untechnical in terms of within the ICS, there'll be 2 boards. A partnership board, and that's where we will engage with health and wellbeing boards, voluntary sector, Health Watch, etc. So that really is a partnership board at a South West London level. And then there's the ICB, which brings the integrated care board, which brings the NHS parts together across South West London. And again, excuse me, that's the health bit, the statutory health bit, where the budgets for health will go through. So next slide, please. Excuse me. Place-based partnerships. So the integrated care, keep going on the slides, the integrated care board will then delegate some budgets and some authority down to place. And that's currently everything that is out of hospital. So your community health budgets, your primary care budgets that are not the core contract, our voluntary sector budgets. And that will delegate down to place. And it will, for us, obviously, the place is Merton. That just is a diagram that shows you at place, we'll be looking at all things out of hospital. And next slide, please. And then the scope of place, planning, community, mental health and community services, everything that goes up to the front door of acute services, social care, primary care, public health, prevention. And these budgets for each area could be up to the region of about 50 million. Really important that we emphasize these are NHS budgets. So these are currently budgets that will then get delegated down to place. I think the 50 million in Merton's probably more in the region of 30 million. But it's just because of the size of the investment. So, but we will confirm that figure as we go through the process. Next slide. Now, there's been a lot of discussion about actually how would we manage that? And as the guidance sort of set out 5 options, and the option that we've recommended and have been kind of driving through the transition team is the option 3, the committee of an ICB, a borough committee. And that is because the borough committee will allow us a safe transition to the new world of ICS without throwing everything out and the baby with the bathwater. But just to be really clear that that is a partnership group. It's got partners from local authority. It's got partners from the voluntary sector. It will have partners from Health Watch. And it is hopefully reflects the partnership across Merton. The reason that we haven't gone for option 4 or option 5 is that actually a joint committee means we all pool our budgets, and I really mean pool our budgets. We all make decisions on each other's budgets. We're not quite there yet. We've got some work to do. And then the lead provider. We didn't think that actually within our current arrangements, there's only one provider that would take the money, and we need to develop trust in the relationships as well. So we really need to look at, from April the 1st, what is the ambition for Merton in terms of moving the borough committee and moving Merton Health and Care together in a more integrated way than it currently is. And I think that's really exciting. So what we did want to say was that option 3 is the starting point of a journey, and that's to land us on the 1st of April. But actually then the next 2 years will be really fascinating in terms of how we can then join up even further. Next slide, please. I'm going to just jump on and not ask that question because I'm going to make a proposal instead, Clarissa. And again, that just sets out who will be invited onto the borough committee. Many of the names are already in the transition team, but we do want to make sure that, for instance, the primary care leadership has the mandate of primary care to attend the borough committee on their behalf. Final slide, please. I think. Keep going. Okay, so I'm not going to ask these questions because myself and Dagmar talked earlier, and we thought that the borough committee construct has been agreed kind of across all 6 boroughs, and that is an NHS construct, isn't it? And what we think the power of Merton Place is absolutely what happens on April the 1st and in the next 2 years. How do we integrate? How do we pull budgets? So some of the questions that are posed here is a little bit of homework, actually. We're asking people to take these slides away, and perhaps for the next Health and Wellbeing Board, we have an in-depth conversation about really what is the ambition for Merton in terms of integrated services, integrated teams, and integrated kind of governance and budgets. So I'm going to kind of stop there, apologize for the length of the presentation, and then ask anyone for any questions.
Thank you, Mark. And I guess when we share the minutes, we can add those questions to the top of the email so we can gather feedback in the interim, but also pick it up at the next meeting. Were there any questions on the slides presented or any of the content there?
Included with the minutes.
Oh, yes.
But,
No,
you've got
absolutely.
Something to
Absolutely. And
come
I
back
think
with, otherwise you'll be presenting the same slides again or something.
yes,
Thank you.
absolutely. Yeah, Dagmar.
Yeah, so thank you, Mark. It is quite an art to turn the abbreviations and new structures into anything intelligible and exciting. So good try. What I think we as Health and Wellbeing Board really need to do, we are a statutory committee, we remain a statutory committee. We have accountability to our community. This is a public meeting. This is shared by an elected councillor with vice chair of the CCG. So it's upon us to rethink how are we leading place going forward with the other players on the ground. We're already working very closely with Merton Health and Care Together, where we have actively engaged with our local providers, including our PCNs, but our community provider, mental health provider, acute. So we've got Merton Health and Care Together. And now we have got the new kid on the block, our local borough committee. So the trio of the 3 really need to think how we are shaping place and going forward, how we complement each other and what are the opportunities for the future. And I think it's actually quite exciting what we can to shape. But in terms of not getting too, as I think Mark Allison said, bamboozled or hung up, the starting point is building on what we've got on 1st of April and then working from there rather than running before we can walk.
Thank you, Dagmar. And I suppose it's probably fair to say that at the moment, most of the focus and conversation is on governance as opposed to actually any of the sort of content. So it feels a bit more intangible right now, but we will get there. Simon.
Yeah, thank you, Chair. I was just going to build on a point that Dagmar sort of finished on, which we had a presentation of the 6 PCNs at the ICS transition team earlier. And I just think we shouldn't lose sight of the fact that we've got a lot of really good stuff going on in health and local level and in the acutes. And in a way, we step into ICS with a lot to celebrate in Merton and a lot of innovation, a lot of opportunity for further collaboration. So I must admit, from the earlier session, which was ICS specific, obviously, I'm with Dagmar. I think it's quite exciting where Merton is already positioned. I know there's the structural things to sort out, but I think we're in a strong place. I just wanted to share that, because presentation earlier across what all the PCNs do is really well worth sitting through from my perspective. Thank you, Chair.
Thank you, Simon.
I suppose I just respond to both, saying that actually it's the Health and Wellbeing Board, Merton Health and Care together, really established. We know what we're doing with them. There's a great partnership ethos, and the Borough Committee initially will try to complement that. But actually, over a period of time, we will look at how we can make that more joined up. It's just to emphasize the 1st of April is a landing place for the ICS. And then I think we have the really exciting stuff around actually what are we going to do for the residents of Merton? What are we going to do together to have an impact on some of the areas that we've heard in many discussions tonight, like inequalities, etc. So I see it as a starting point.
Thank you, Mark. I can't see any further contributions on this item, so thank you for bringing that to us, and I'm sure we'll get another update at the next meeting. And I will leave you to update on, I think, the next item on Mitcham Health and Wellbeing Hub.
Beginners luck. So just to say, this again is very, this will be a very brief update, but we just wanted to make sure that the Health and Wellbeing Board were aware of where we were at in terms of the Mitcham Health and Wellbeing Hub. So the hub, we have identified funding for the hub, and that's a combination of CCG funding and then property services funding. And we're really excited about that because that's taken a very long time to get to confirmation. The process is that we then start to write a business case. And the business case requires us to look at 3 options. But I just want to emphasize that the Wilson is the NHS preferred option. And we are working through that business case process right now. Once the option is then agreed, and we think that will be sometime in the new year, we will then write out a full business case about the services, the estate, etc., of the hub, and we will take that through the programme board. The programme board has been re-established once the funding was agreed, and we have met twice, and that's predominantly about getting the first stage through the gates in early next year. Just to say that in terms of, I think there's another slide. We just wanted to say that the Wilson is also got a number of other things going on there at the moment. So it's not standing idle. Obviously, it's a vaccination centre. There is a community garden opening up there. There is some exciting wellbeing services just about around social prescribing, and also in addition, a mobile MRI scanner opened on the site in October. And so we are beginning to see the Wilson really being used for community-based services and tying into some of the things that we heard around the sustainability plan, the green spaces for communities to come together. So I just wanted to basically say programme board is established. The Wilson is the preferred NHS option, and we are working through getting that options paper through as soon as we possibly can, so that we can then get on with kind of populating the services and putting the services in place.
Thank you, Mark, for the update. I know that the community is keen to understand sort of the progress with the Wilson, so it's really helpful to hear that. Were there any questions on Una?
A quick one on the Wilson, and I mean, I'm well aware that it is currently used vaccination-wise. Historically, it had also been used, and I presume it still is, or perhaps it comes under the umbrella of wellbeing, but it was used for quite a lot of mental health support was provided there, and different treatment and so on. So just wondering whether that's still continuing.
So our mental health provider still does have services there, and I think in the new in the business case for the hub, we would also look to have mental health services as well. And also, given that a lot of what we've heard tonight, actually mental health is absolutely, yeah.
Thank you, John.
Oh, I just wanted to say it's incredibly positive that we've got commitment again to around the East Maritime Wellbeing site. But it is a number of years away. And I think I might have said this before. I'm interested in now in how we start to tackle inequalities now in Maritime. And really, it's important. I just want to link in your minds health on the high street, because health in the high street is a pilot. It will be piloted in east of the borough. And a lot of the work that will be done in health in the high street will link into the services that we provide in the Wilson. So I just wanted to link the two and show some of the work that we're doing to tackle inequality while we wait for the redevelopment of the Wilson.
And just a footnote as well, it's just to say that we're going to, within the programme board, we thought it a good idea actually that we jointly chair it. So even though it's NHS resource, we wanted to extend that into kind of local authority chairmanship as well, so that actually we're steering the programme together.
Thank you. And just on that point that John made around sort of health on the high street, I know we did talk about how we really want to hear from the community about what the sort of services that they would want to see there. And I know, Mark, you mentioned that the sort of full business case with sort of services, kind of the provision of those services is sort of underway. And I guess just a question about to what extent we are able to sort of consult with the community about the types of services that we would want to see there.
I think probably what I would say there is that a lot of consultation has already been done at the Wilson, and what we didn't want to do was lose that. What we do need to do is revisit it in the light of COVID, what COVID's taught us around inequalities, and particularly what are the health needs of East Merton and how best do we deliver that. So some of the work around health in the high street and what we're being told there will shape how the East Merton hub, I keep calling it something else, but it's the East Merton hub, how that will look at the day it opens, really, yeah. So I think we've got lots of different strands we need to bring together and make sure that we're actually, responding to what we're being told.
Thank you. And probably just one final question from me. And I think this was something that had been considered when we were previously talking about the Wilson, but to what extent do you think we'll be able to bring in the community around possibly the name? I know that we're talking about the Wilson, East Merton sort of model of care and the hub, but will there be a stage where we will be able to bring people into sort of more the design and the naming of the Wilson?
Yes, is the answer.
Nice and quick, thank you. Were there any other questions or comments? No. So I think last sub-bullet was on the NHS Green Plan. So again, back to you, Mark.
So again, I'll be relatively quick in terms of the Green Plan. So the NHS is probably the first World Health Organization that's kind of committed to being zero emissions by 2040. And some of the priorities for Southwest London is, again, to go paperless by 2025, to stop buying metered dose inhalers and to recycle those inhalers by 2025. And actually inhalers account for 3 to 4% of carbon emissions. So that's really a key one. To look at wastage and cut that out by 2025. to go electric for all staff and interstate and courier transport. And I know transport's a theme that Chris also touched upon. And then reduce buildings energies as well by 20% by 2025. Now, within South West London, each of the trusts is challenged with writing its green plan by January of 2022. So we're waiting for them, and we know that each trust is on track to deliver that. And then South West London will bring those plans together and really write a South West London plan by April of next year. I think one of the key things that is really important is that we also make sure our primary care colleagues are part of that conversation and part of that discussion, and that in some ways, that for place, it's really important that primary care are involved in the development of place plans as well. The presentation we sent round just gives you more detail in some of those areas about going paperless, etc. Keep going. Yeah, it just tells you the why and then the next steps. So I just wanted to provide that with you. I think one of the questions for Chris that I was going to ask earlier was actually how joined up is the South West London Green Plan to the Maritime plans around sustainability, because that's one area I think we probably over the coming months can really strengthen.
Thank you, Mark. And can I pass over to Chris to answer that?
Yeah, I think that there's the connection with Merton's plan, but also there's the connection with what's emerging around what's called the South London Partnership. So we have a good, strong collaboration with neighbouring boroughs, Richmond, Sutton, Kingston and Croydon and Wandsworth, where we're developing a sub-regional approach to this, because we're effectively all doing the same things within our local authority boundaries, and the potential for us to procure at scale, to undertake behaviour change activities at scale, and to deliver projects at scale, particularly transport projects, allows us to, or gives us the platform for us to operate together. So I suspect if I scratched away at the surface, Mark, the integration between our plans, Merton and the NHS, the South West London plan is probably limited, and there's more to do. But I think there's an opportunity for us to think about how could we also work with the South London Partnership on this, where we've attracted some additional mayoral support. We've got a full-time worker now working on this at scale across the sub-region in order to attract external funding and to develop those local projects. And I suspect some of them will be exactly the same sorts of things that your colleagues in the NHS are doing, and we can connect up with that.
Thank you, Chris. Dagmar?
Yeah, can I just really support that? Actually, there are some links. We are actively engaging. So I've linked up with James Murray, who's the SRO across South West London for all the green plans. He's cunningly also the Director of Finance. That's helpful. But honestly, it has moved absolutely humongous distances. And I think it's interesting because the NHS is one of the first health systems that as a whole system says this is our priority. And if you look, the actual footprint, the carbon footprint of health services is big. So we're not just tweaking around the edges. What I was so impressed when I started to link up with NHS colleagues were actually how many experts and real passionate leaders are now coming out of the woodworks amongst clinicians, about managers. There's a whole pan-London delivery group led by the NHS. And can I just say primary care is in there? And some of even our primary care folks with some very active GPs locally that have already looked at how you run a green practice. And if we just go back to the previous presentation from Chris, it's the core benefit with health. And so if the health service also starts to think, God, you know, how can we get our patients active? How can we get them to change their food, because we've got diabetic clinics, we are amputating legs, and we are dealing with blindness. This is now the similar stuff. So pulling it together opens up real new opportunities to bundle our energy and possibly shift it this time round. So really exciting stuff.
Thank you, Dagmar. Karen?
Yeah, could I ask if any thought has been given to the impact of the use of PPE during COVID, and also things like lateral flow tests? And you know, that must have obviously had an adverse impact from a green perspective. So I just wondered if any thought was given to that around maybe rationalising the use, particularly of PPE, obviously within national IPC guidance, to ensure that as changes come on board, that they are actually being adopted.
Yeah, spot on, Karen. Right at the beginning of the lateral flow test jamboree, we sent it right up to the Department of Health, and they said, that's a good one to consider. Unfortunately, on the lateral flow test, it hasn't turned into a recyclable set yet. So watch that space. I think more work has been done on recyclable PPE, but it's tricky. There are some initiatives, particularly in acute trusts. So on the agenda, but difficult. And for me, it's a really good example that the theory is sort of fine. And what we then all have to do is really work through the details. And the details are hard. But we know where we want to go. So I think we find a way. And I think the PPE challenge is a real one. And it's a good reminder. I've got a London meeting on Friday, and I will yet again put it there. Thanks for reminding.
Thank you, Dagmar. Well, were there any final questions or comments on this item? No. Well, that does bring us to the end, but could I just mention one final piece of AOB? I'm sure colleagues will be aware that sadly this is the last meeting that we'll have Rob Clark with us, and I just wanted to put on record on behalf of the Health and Wellbeing Board a huge thank you to Rob for his role on this board and the subgroup, but also his work across Merton, and he will definitely be missed, but we wish him all the best in his next venture. I don't know, Rob, whether you did want to say anything or we just close slightly.
I would just say thank you, and it's been a real privilege working with you all. Yeah, I'm just grateful for the opportunity to have worked with you all, and I've learned a lot, so thank you very much.
Thank you, Rob. And on that note, that does bring the meeting to a close. So thank you for all for joining, and